And so I'm going to be giving you a lot of information. You're going to have the presentation to review later. If you ever have any questions, you can always give us a call on our intake line. We're going to put that in the chat. So today I think it's important to talk a little about some background information on the Medi CAL program. We're going to talk about some Medi CAL basics with regard to eligibility. I'm going to show you where you could find Medi CAL programs that are for people with disabilities. In other words, a requirement for getting on that particular Medi CAL program is that you be a person with a disability. Of course, there are people with disabilities who are on Medi CAL programs where disability is not a criterion, but there are very specific programs that require that the person be disabled. I'm going to go through some of the Medi CAL services. I'm going to talk about what happens with Medi CAL when you have other health coverage, how to apply, how to manage your benefits online, and some updates regarding the Cal AIM initiative. So let's get started. I think it's important to understand some terms and some of the agencies involved in this program. So the federal term for this public health benefit is called Medicaid. And there are states that use Medicaid. Of course, California has to be a bit different. And so we call
I want you to sit in.
We call the Medicaid program Medi CAL in California. The Centers for Medicare and Medicaid is the federal agency that administers the Medicare, which is a very different public health insurance program, and the Medicaid program nationwide. Now, every state is required to have a single state agency that administers the Medicaid program. In California, it's the Department of Healthcare Services, but DHCS can delegate to other agencies some of its responsibilities. Obviously, Department of Healthcare Services will ultimately be responsible, but there is delegation. So, for example, in-home supported services is a Medi CAL service, and that service is administered by the California Department of Social Services. There's a memorandum of understanding between Department of Healthcare Services and CDSS for that. When California decided to take federal money and get on the Medicaid program, it had to submit a state plan to the Centers for Medicare and Medicaid, or CMS. And the state plan describes the nature and scope of the Medi CAL program. For example, what programs are going to be, what Medi CAL programs are in California, who's eligible for the programs, services that the optional services that California has agreed to cover, and many other things. Now, CMS obviously approved California state plan. And as part of that, California, in receiving federal money to help pay for its Medi CAL program, it agreed and has agreed to follow federal laws and regulations and guidelines. The state plan is here, should you want to see it. And when I talk about the federal government helping to pay the Medi CAL program in California, we're talking about federal financial participation, or FFP. So there are programs in Medi CAL programs in California where the federal government is helping to pay for the services, etc. But there are also Medi CAL programs in California where there's no federal financial participation. It's California paying for it. So those are called state-only Medi CAL programs versus Medi CAL programs where there's federal financial participation. Like I said, this is a complicated area, and I'm going to try to break it down as simply as possible. So let's talk about service delivery models. There are two. There's fee-for-service, and then there's managed care. Fee-for-service is, if you're on Medi CAL fee-for-service, you can go to any provider, Medi CAL provider in the state of California and see the provider, and that's it. But most people on Medi CAL are in a managed care plan. And you have to, within the county, there are different models of managed care. And I'm going to go ahead and stop sharing, and we're going to open up the link. There are a number of links that I've given you, and I'm only going to open up the first one so that you understand that in California, there are different models of Medi CAL managed care. Some models, so for example, the Coast County models, all of these in gray, are counties where there's only one available managed care, Medi CAL managed care plan. Typically, it's partnership. There are other models in the state of California where there are two plans. Sometimes there's a public plan and a private plan, or there are also in California single plan models, regional models. So this is the current state of affairs. Recently, more counties were added to the Coast model where there's only one managed care plan. You have no choice but that one. Whereas in other counties, you have a choice of more than one Medi CAL managed care plan. So thank you for that. We are going to go back to the presentation. If you want to know more about the models, there's more information here. But most people are in a managed care plan. So for example, in LA County, you have Molina, LA Care, you have about 4 or 5 different choices. And so you choose the Medi CAL managed care plan that you want to be in. If you don't choose, they'll choose for you. You can move from managed care plan to managed care plan. You have to have a primary care doctor. Sometimes you have to choose a group under which you'll receive care. So that's the way that service is delivered, those two models. More than 80%, like I said, of people on Medi CAL are in a managed care model and have to be forced into it, no choice. So let's talk about services. And I'm bringing up terms because you might hear these things and not really know what they mean. So for services, sometimes they'll say, oh, you have Medi CAL full scope, or you have Medi CAL restricted. Full scope means that you can ask for all of the services that are available to you under the state plan. So in-home supported services, nursing, community-based adult services. You can apply for the different waivers that Medi CAL has, durable medical equipment, mental health, dental health, vision health. All of that is available to people who have full scope Medi CAL. There is Medi CAL that's restricted. So, and the interesting thing is that it was restricted because the person's immigration status wouldn't allow them to qualify for full scope Medi CAL. Well, as you will learn, if you don't know already, immigration status doesn't matter anymore for Medi CAL. So the restricted programs used to be emergency room Medi CAL, so or pregnancy related or long-term care, like in a nursing home. But now that immigration status doesn't matter for the Medi CAL programs, unless the restricted, unless you can't qualify for some other reason, you should be able to qualify for full scope. And in fact, this link here will talk more about that. I'm not sure that restricted is important anymore because immigration status doesn't matter for Medi CAL anymore. Medi CAL services. So we're going to go to this first link to show you the services, but there's also a very good guide to Medi CAL services and help. It's a national organization created a manual. It's the Advocate's Guide for Medi CAL Services, which is really great. So, you know, you could go there, but I just want to show you just how rich the Medi CAL program is. It's, you know, if someone were to ask me, Maria, you have, let's say I have Kaiser Insurance. Would you rather have Medi CAL or Kaiser Insurance? And I would have to say I'd rather have Medi CAL because of the breadth of services that are available through Medi CAL. You get things that are probably not covered through private insurance, not covered through Medicare. It's just a very rich program and services. So, for example, essential health benefits including outpatient services. So you see physician services, podiatry, chiropractic, allergy care, dialysis, emergency services. It covers, if we scroll down, it covers hospitalization, maternity and newborn care, mental health and substance use abuse and substance use disorder, drugs, dental under Denti-Cal here in California. If we scroll down some more, we have all kinds of therapies, physical therapy, speech, acupuncture, pulmonary rehabilitation. You get durable medical equipment, orthotics, hearing aids, home health services, someone to come to the home, for example, a nurse to come to the home and give you an injection, laboratory services, preventative and wellness services. So if we scroll down, we've got smoking cessation services, family planning services, and for kids under the age of 21, some pediatric services, including oral and vision care for adults too, enhanced care management, which is something that is relatively new that I'm going to talk about and give you a link to later on. Transportation services, so Medi CAL will pay for you to get to your Medi CAL providers. And you can arrange that through if you're in managed care, through your Medi CAL managed care plan. Long-term services and support, so Medi CAL will pay for you to live in a nursing facility. It'll pay for waiver services for a nurse to come. If you qualify for the waiver, you can have a nurse come to your home and provide services. Personal care services, a lot of things here. So, and this is not an exhaustive list of services, but the essential health services that are provided. So very rich program. Thank you, Lonnie. Going back to the presentation, and you have the link there. Now, like every insurer, even a private insurer, you can ask for a service, but you have to show medical necessity for what you're asking, right? So if I'm asking for a power wheelchair, I have to show that it's medically necessary. And every insurer, including Medi CAL, has its own definitions for medical necessity. So when we're talking about Medi CAL for adults, anyone 21 and older, a service is medically necessary if it's reasonable and necessary to protect life, to prevent significant illness or significant disability, or alleviate severe pain. So when a doctor is prescribing something, the doctor or the health provider has to show why what he's asking for you is medically necessary, and has to use the magic language, right? For kids under the age of 21, these kids are covered under an umbrella called, I call it an umbrella called Early Periodic Screening, Diagnostic, and Treatment, or EPSDT. And the medical necessity standard for kids is much broader. It's anything necessary to correct or ameliorate a defect, physical or mental illness or condition. And kids actually get extra things that adults don't. So if you want to know more about protections under EPSDT for children under the age of 21, there's some really good guides. The guide written here and some other information here. So remember, in order to request any Medi CAL service or support you have to show, where the provider has to show medical necessity. Now, something like a wheelchair will also have criteria that needs to be met to get, for example, a powered wheelchair. And there are manuals of criteria for different things in the Medi CAL program. So let's talk about Medi CAL eligibility. It's really important to understand that in California, we have a lot of Medi CAL programs. There's not just one Medi CAL program. We have, if you're getting supplemental security income or SSI through Social Security, then you're automatically getting what we call SSI linked Medi CAL or categorically linked Medi CAL. And that Medi CAL follows the SSI rules, because if you're eligible for SSI, then you get that categorically linked Medi CAL. So resources, countable resources are important, and income is important. So someone who's on SSI, an adult, for example, can't have more than $2,000 in countable resources. A couple applying for SSI can't have more than $3,000 in countable resources. And so that Medi CAL has the same rules because it's categorically linked to the SSI. But aside from this categorically linked Medi CAL, there are many, 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 many other Medi CAL programs. And each program has its own income rules and deductions to income to get to countable income. It's got its own criteria for eligibility. So when I was doing casework and someone called me about a Medi CAL question, I would want to know, the first thing I would want to know is, well, if I couldn't figure it out with whatever paperwork I got, I would want to know what Medi CAL program this person was on, because it's the only way for me to be able to help them. Because like I said, every Medi CAL program has its own eligibility criteria. A way to find out what program you're on is look at your notices of action. Those may tell you what program you're on. I've been told that if you go to a pharmacy and you swipe your Medi CAL card, you'll see an aid code, and I'm going to show you a link, and we're going to go to it where all the Medi CAL aid codes are, and depending on what aid code you're on, you'll know what Medi CAL program you're on. So we've got this categorically linked Medi CAL to SSI, and we have other Medi CAL programs, many others. So you might be asking, what Medi CAL program am I on? Well, you can always call your Medi CAL eligibility worker and ask, what Medi CAL program am I on? Or go to a pharmacy and swipe the card to see what you're on. And at the pharmacy, they're going to give you an aid code. So here are the Medi CAL aid codes, the current aid codes, and we're going to stop sharing and we're going to go there, and you're going to there are 90 some odd pages of aid codes, different Medi CAL programs. I'm not kidding you. This is like, who knew, right? So if we scroll down to, we'll just past these pages, go further down. Okay, so here we go, aid codes. So wait, you can stop anywhere, it doesn't matter. So aid code 13 means you're on the medically needy long-term care Medi CAL program. It provides full scope benefits. It's possible that you may have a share of costs. There are Medi CAL programs in the medically needy program where you'll have a share of costs, meaning that you have to spend the amount of your share of cost every month in medical services, dental, vision, before Medi CAL kicks in that month. So if I have a share of cost of $1,000, I have Medi CAL, I'm in the medically needy program, and I have a share of cost of $1,000, I have to spend every month $1,000 in medical expenses, dental, vision expenses before Medi CAL kicks in. If I don't spend that $1,000 a month, I don't have Medi CAL for that month. And so anyway, so there are, I don't know, 90 some odd pages of different Medi CAL programs. So if we scroll down some more, you'll just see this is what the aid codes look like. So depending on what aid code you're told, you'll see what program you're in. And knowing what program you're in, you could find out more about the program and figure out if what they're telling you is correct or not. But anyway, I wanted to show you this so that you understand that what your aid, what program you're on matters when we're trying to help, right, with a problem. So there's the link to the aid codes. About Medi CAL, money is considered income in the month you receive it and a resource in the subsequent month. And this is important for the SSI program, okay? So right now, like resources, I remember I told you immigration status doesn't matter anymore. Well, resources for the non-SSI Medi CAL linked programs don't matter anymore. So when we're talking about resources, it's really that categorically linked Medi CAL to SSI, because SSI does care about resources, does care about countable income, but these other Medi CAL programs are really about, is your income at the level that would allow you to qualify for the Medi CAL program? So the general rule is income 1 month, resource the next. But there are certain situations where income 1 month won't become a resource the following month. You'll have time to spend it down. But like I said, it doesn't really matter if you're in a non-SSI categorically linked Medi CAL program, because resources really don't count. But they where you have time to spend down the resource before it becomes the money, the income, before it becomes a resource. If you're on SSI, you're going to want to look at this publication down here. If you are on any other Medi CAL program, I'm not sure that this is important anymore, because it doesn't matter what your resource is and how much you have in resources for the Medi CAL programs, especially the programs that we deal with, which are focused on, one of the qualifying factors for those programs is that you have to have a disability. So this one I'm not sure is very relevant anymore. This one, the SSI, if you are on SSI, you have the categorically linked Medi CAL SSI Medi CAL program, and this is important. This one here, probably not as important anymore, because resources don't matter. And talking about resources, again, I want to stress, if you're on SSI, you're in the categorically linked Medi CAL, resources still matter. Other Medi CAL programs, there are 2 links here, and they will tell you that resources don't matter anymore. Last year, they had increased the resource limit to 130,000. This year, it's gone away. So you could, if you want more information on that, you can open these links for that. It's just making the program a little easier, right? But talking about resources, especially if you're on the SSI categorically linked Medi CAL, remember, under that program, if you're an adult, you can't have more than $2,000 in countable resources. But if you're eligible for an ABLE account, and there's more information on an ABLE account, you can save money in your ABLE account. If you're on SSI, you can save up to $100,000 in your ABLE account, and it won't affect your eligibility for SSI or Medi CAL. So this slide is really applicable to, most beneficial to people who are on the SSI categorically linked Medi CAL. Because like I said, the other Medi CAL programs don't care about resources anymore. And I wanted to give you some links to the immigration changes. So immigration status doesn't matter anymore. You can be here without, you know, just without any immigration status really, and apply for Medi CAL. But you need to remember, every program in Medi CAL has eligibility rules. So the Medi CAL programs won't care anymore about your immigration status, but you still have to comply with the other criteria for the Medi CAL programs that the county's looking at to qualify you for. So income limits will still matter, etc. And there are links about immigration status no longer mattering for full scope Medi CAL. The other thing is sometimes people are afraid to apply for Medi CAL because they're afraid of public charge. Public charge is a term that's used when someone is applying to become a lawful permanent resident. The government is looking to see if this person is going to become a public charge. In other words, is the government going to have to maintain them? And so Medi CAL is one of those benefits, except for residential nursing home or mental health institution care, except for those services. Medi CAL will not affect public charge. It's not one of those benefits that are looked at to determine whether someone will be a public charge. And there's some really good guidelines here, one in English and one in Spanish, about that, so that people are not, there had been a push to increase the number of the kinds of benefits during the Trump administration. There had been a push to increase the types of benefits that could be included in a consideration of public charge, and it included Medi CAL benefits under certain conditions, but that never passed. So in effect, the law hasn't changed since a very long time. Now, earlier I mentioned there are Medi CAL programs where a criterion for eligibility is that the person be disabled. So there's a really good website called db101.org that talks about these programs. The MAGI program, the Modified Adjusted Gross Income Program, California got it during Obamacare. And that program is available to people in certain who meet certain criteria, who are not on Medicare and in between certain ages. And this program, the MAGI program, doesn't care if you have what resources you have. So this technically was one of the first programs where resources didn't matter. But with the recent change in the Medi CAL program now, even for these non-MAGI Medi CAL programs, resources don't matter, except the SSI. Remember, SSI resources matter, still matter, because your Medi CAL is linked to the SSI. So we're going to go to this. I wanted to show you this website so that you can learn more about the programs. And like I said, every program has its own criteria for eligibility. So when we're talking about income-based Medi CAL, we're talking about that MAGI Medi CAL program. So to qualify, you have to live in California. You can't be on Medicare. And it's for people in the following situations. So if we scroll down, for people in these age ranges with income below a certain federal poverty level, and it talks about other things that could affect eligibility for the MAGI program. So there are people who have disabilities who've been found disabled by Medi CAL who were not placed in a program where disability is a criterion, but may have been placed on the MAGI program. What does it matter? You're still getting full scope Medi CAL, right? What I want to say is that just because you have a disability doesn't mean that you're limited to Medi CAL programs where disability is a requirement. If we scroll down some more, we start to, so now we have some of these, we work, these are some of the programs that we work with people with disabilities where disability is a requirement or age. So we have the aged and disabled federal poverty level program, the SSI linked Medi CAL program. I've been talking about that. The SSI 1619B program. So you may have gone back to work and your earnings are too much for you to get the money benefit in SSI, but you might be able to continue with your Medi CAL under the SSI 1619B program. There's the Medi CAL Working Disabled program. So if you are working, you might be able to continue with your Medi CAL despite the fact that you're working under the Medi CAL Working Disabled program. And then there's the Aged, Blind, and Disabled Medically Needy program. This is the program where you might have a share of cost. And one of the things that we do is if you're placed in the medically needy program, what we try to do is try to get you into one of these other programs where you wouldn't have a share of cost, because having a share of cost is not a good thing. And so here we go. If we scroll down, it says no more Medi CAL resource limits as of January 2024. Note, this does not change SSI linked Medi CAL or Medi CAL through the SSI 1619B program. For those of you who are on SSI, don't get confused. You still have to worry about resources to keep your SSI and the Medi CAL that's linked to the SSI. And then Medi CAL and immigrants, immigration status doesn't matter anymore, right? So, and then as you scroll down, you start to see the different programs, and it starts to tell you what the criteria is for the program. So be either aged 65 or older or disabled, and you have to be found disabled. They use the Social Security definition of disability. Medi CAL uses the same definition. Medi CAL uses the same disability determination services, the analyst that works there to make that determination. So if you have less than 1,677 in countable monthly income, or a couple applying for this program, your countable income has to be less than 2,268. Medi CAL will never look at gross income. Every Medi CAL program will tell you what you can deduct from your gross income to get to countable income. So, for example, for the Aged and Disabled Federal Poverty Level program, it says that you use the SSI rules for countable income. Okay, there are formulas that are used for the SSI, and then they tell you what the rules are. If you click the blue part, you're going to get to that information. But if we scroll down, in addition to the deductions that you can use to gross income to get to countable income, you can also further reduce your gross income to get to countable income for the number of people in your household who are not applying for this program. So if I have a husband and a child and I'm applying for the Aged and Disabled Federal Poverty Level program, that would be 2 people. I can deduct an additional $750 from my gross income to get to countable income. So, and you can also, if you have impairment related work expenses or blonde work expenses, so it's not like I can tell you there's one Medi CAL program and these are the rules. This is the criteria for getting on that Medi CAL program. That does not exist. Every program has its own rules for qualifying for that program. So if we scroll down some more, it tells you how to get, and if you're living in a board and care facility, you can subtract another $315. And then it goes on to the other programs. We don't have time to, I could do a training on just one program. But at least you know where to find the information. Also, thank you, Lonnie. At the end of the presentation, I've given you a link to a manual that was written by Western Center on Law and Poverty on Medi CAL eligibility. It is a fantastic, it's like I go to that whenever I have questions. It's fantastic. The only problem is that it was written and it was published in 2016. So, you know, with Medi CAL, we're always talking about federal poverty levels, and the federal poverty levels change every year. So in order to use that manual, you have to be current on what the federal poverty levels are for 2024. And that's not difficult. You can find that information. So Medi CAL is for people who were on SSI and Social Security disability insurance. There are people who are getting both of those Social Security benefits. And so you're on SSI, you have Medi CAL, right? But there's a cost of living increase in your Social Security disability insurance that kicks you off the SSI program. What happens when you lose SSI? You lose the categorically linked Medi CAL that comes with the SSI. Well, if that happened to you, you could qualify, continue to qualify for Medi CAL under PICL Medi CAL. Disabled adult child Medi CAL is for children who were, for example, on SSI. A parent dies and would have been eligible for Social Security benefits, becomes disabled, and the parent becomes disabled and starts receiving Social Security disability insurance, or the parent retires and starts getting Social Security benefits, then the adult disabled child might be eligible for disabled adult child benefits, and it may take the child out of the SSI program. Take the child out of the SSI program means no categorically linked Medi CAL, right? Because you're not getting the SSI anymore. Well, this program says that you can continue your Medi CAL under the DAC Medi CAL program. And then these are the other ones on DB 101, and DB 101 talks about these. And that Medi CAL manual from Western Center on Poverty and Western Center on Law and Poverty talks in detail about all of these programs. Wonderful, wonderful publication. I can't say enough. There's a concept in Medi CAL that we need to discuss when we're talking about resources and income, and it's called deeming. So if a child is going to apply for Medi CAL will look at the parent's income and resources, the parent with whom the child lives, to decide whether the child should qualify for Medi CAL. And it's possible that the parent or parents have too much in income and or resources, and that disqualifies the child from getting Medi CAL. There's also spouse-to-spouse deeming. So if I'm married and I apply for Medi CAL, my husband's income and resources will count as if they were mine. And resources, let's talk about it. It's only really important for the SSI program, no longer important for the other Medi CAL programs. Sponsor deeming, if my sister sponsored me, she promised and signed a federal form saying that she was going to take care of me so that I could become a lawful permanent resident. And she's my sponsor, and I turn around and apply for Medi CAL. It's possible that Medi CAL will look at my sister's income and resources and her spouse's income and resources to determine whether I qualify for Medi CAL. So for all of those other Medi CAL programs that are not SSI, income is what's deemed. It used to be income and resources, but no longer, just income. For those people who are on SSI linked Medi CAL, resources and income will be linked. Okay. Now, I know some of you are probably saying, but wait a minute, why don't you talk about the institutional waivers? Well, there's a concept called institutional deeming. But let me back up a bit. There are services in the Medi CAL program called waivers, and I do a whole training on waivers, so there's no way I can talk a lot about these waivers, but these are, just think about these, extra services for subpopulations of people who are on Medi CAL. So if I apply for example, the DD waiver through the regional center because I'm a consumer of the regional center, or I apply for the home and community-based alternatives waiver, or if I get on the self-determination program through the regional center, there is language in these waivers that say that if the person qualifies for a waiver, extra services for the population that's described in these different waivers, then you, Medi CAL eligibility worker, will pretend that the person who's applying for Medi CAL is living in an institution. Because remember, deeming applies to parent, when we're talking about minor kids, the parent with whom the child lives. So if Medi CAL pretends the child is an institution, the spouse is an institution, then there's no deeming. So that's what institutional deeming means. So there are children who, under the general Medi CAL rules, would not qualify for Medi CAL because of deeming, who then get on, children and adults, who then get onto a waiver that has the institutional deeming language, and now they qualify for Medi CAL because they're not looking at the other people's income and or resources to qualify them. And if you want to know all the waivers in California, all of the, these are home and community-based waiver services, and there are more. If you want to learn more about Medi CAL waivers, you can go to the link here and it'll give you more information. So there is a way not to deem income and resources if you get on one of these waivers that allow that to happen. Okay, so when you get Medi CAL, you also get DentaCal, and I've put a link here to the DentaCal program. There are different kinds of programs in the state, so you can get a lot more information there on the DentaCal program. Also, if you get on, and this is full scope Medi CAL, right? If you are on full scope Medi CAL, you also can get vision care, and I've included the link to that right there. Now let's talk about Medi CAL and other healthcare coverage. Medi CAL will always be payer of last resort. In other words, if I have private insurance and I have California Children's Services, let's say I'm age 19, I haven't aged out of CCS. I can have private insurance, I can have CCS, and I can have Medi CAL. So how does it work? Well, private insurance will be billed first. It'll cover, not cover, cover some. Then it'll go to CCS, and CCS will cover it if the service or support is for the CCS, the condition that made me eligible for CCS. If it's not for the condition that made me eligible for CCS, then it just goes to Medi CAL, and Medi CAL will pay for the expenses it would cover, normally. And if it's a service it would cover. And even with Medicare, it's the same thing. Private insurance first, Medicare, and then Medi CAL. So Medi CAL will always be payer of last resort. One of the things, because we had a conversation yesterday about a case involving a child who's in school, and the school wants to have the parents sign a document that will allow the school to bill Medi CAL because now the child is eligible for nursing care at home. And so they want to, through the waiver, the home and community-based alternatives waiver, and the school wants to use the waiver nursing hours at school so that the school doesn't have to pay for it. Well, as a parent, they're not required to sign that document allowing the school to use Medi CAL for the nursing that it has to provide at school. And so thought that was an interesting conversation, because parents typically sign the document, right? But those home and community-based nursing hours should be done at home, right? Because there are only a certain number of hours of nursing care that you get under a waiver. And why would you want to use them at school when the school has a separate obligation to pay for services that are necessary for the child, including nursing? I want to talk about the California. This is California Advancing and Innovating Medi CAL. It's called CalAIM CalAIM is a waiver. It's a different kind of waiver, 5-year waiver. And what are the goals of the waiver? To improve services and outcomes for people, to standardize and make getting the services more equitable in the state, to ensure that people who need the most help are getting it through proactive outreach, and in some cases, depending on your managed care plan, combines medical care with new non-medical services, including respite, personal care, meals, housing. Yeah, you heard it. When I first read it, I was like, wow, I've never seen these kinds of services available through Medi CAL, right? Because you're thinking healthcare services. So things have already happened, and obviously I can't go through everything that's happened in this presentation, but I will give you resources so that you could look into it more. So there are services and supports that managed care plans are obligated to provide. And there are things that they're not obligated to provide. The services that a managed care plan have to provide are called carved-in services. For those services that they don't have to provide, that you would, as a Medi CAL recipient, you can still get, but you're not getting it from your Medi CAL managed care plan. Those are carved out services. So in January of last year, all managed care plans had to now cover skilled nursing facility care. And in July of 2023, also cover intermediate care and subacute care facility services. So now these services are part of the managed care's obligation to provide. Don't get confused. You could still get, even if they were carved out, you could still get them if you qualified for them, but not through your managed care plan. But now these services are part of the menu of services that your managed care plan can provide. So in specialty mental health services are now the responsibility of county mental health plans in all counties. Medi CAL covers certain mental health services. And I think we still have a publication online that talks about all the services that a managed care plan is required to provide, but sometimes there are more complicated cases that may require specialty mental health services. And now you go to the county mental health plan to get those. In 2022, more people were obligated to enroll in managed care. So these people used to be in fee-for-service. Now they're in managed care. It includes people who had other health coverage, because before, if you had other health coverage, like if you had private health coverage, you could still stay out of the managed care system. Now it doesn't matter. You could still stay out of the managed health care system if you get what's it called? An exemption. I think that's what it's called. And sometimes you can even get care that outside of your managed care plan, if their managed care plan doesn't have that kind of care that you need. That's called it's out of care, out of your managed care. There's a name for it. It's just escaping me right now, but we have a publication on that on our website. Yeah, so there were people who had been in. Also, a change that happened under CalAIM is that some people who were enrolled in managed care or had the option to be in managed care were moved to fee-for-service. The other things that, so other people were required to enroll in managed care. Dual eligibles are people who are receiving both Medicare and Medi CAL. Or if you were enrolled in a waiver program, now you're in managed care, or you're in long-term care. Even if you have a share of costs, now you're in managed care. There was a big change, integrated care for dual eligibles. It used to be called the Cal Coordinated Care Initiative, Cal Medi Connect. For people who were in Cal Medi Connect, where the Medi CAL managed care plan, there were only a number of counties, including LA County and like 8 or 9 counties, and not just a handful of counties where you could opt, if you had both Medicare and Medi CAL, you could opt for your Medi CAL managed care plan to take over your Medicare plan. In other words, it all comes together under your Medi CAL managed care plan. Why? For better care coordination. And that was CalMedi Connect. And that went away. And now they have the Medicare Medi CAL plan. And that is discussed in this link. And then, those different managed care models, the map that I showed you, more counties were included in the Coast County model, where you only have one managed care plan. You don't have choices. And I think in most of those counties, the coast counties are a partnership. There's more information about CalAIM here, but there's more to say about CalAIM. This is really important. And all managed care plans are required to provide enhanced case management, care management, that it will provide additional support to persons in managed care with complex health needs. Look up the link to see if you would qualify, or the person, someone you know, would qualify. If so, you need to call your managed care plan and say, I want to know more about enhanced care management, and possibly enroll. Community supports, also known as in lieu of services, managed care plans can offer, it's not mandatory, they can offer community-based services or settings as alternatives to those covered under the state plan. And the goal of community supports is to help people who are receiving Medi CAL in a managed care plan to meet needs such as food, housing, community transition services. Like I said, it's an option. And if you want to know if your managed care plan has community support, you need to reach out to them and ask them. Some new dental benefits came out too, and you can read more about that. And there's more here on CalMedi Connect. And this is more information if you have Medicare and Medi CAL, integrated care for dual eligibles, lots of information there that you might want to look at. I'm not going to open it. Applying for Medi CAL, you can go to the local welfare office. You can do it online. There are many ways to, over the phone, you can do that. I do want to go to Benefits Cal. So once you, let's just go there so that you can see, you can manage your benefit through Benefits Cal. It's available now in all counties, and we're going to look at it. Okay, so if you're applying for benefits, if you're on a benefit, you can use this portal to do your business. And so if you want to apply for a benefit, now remember, local county welfare offices not only manage the Medi CAL program, but they do Cal Fresh, General Relief. They manage a number of programs. So if you want to apply for benefits, you would click here and go on. If you want to manage your benefits, let's say that I'm on Medi CAL and I'm on Cal Fresh. I sign up, I have a username, a password, I can upload documents, I can submit renewals, I can communicate with my caseworker, all through Benefits Cal. I can explore support and Cal Benefits resources. And so there's no more a need to do this by going to the local county welfare office. You can manage your benefits through this portal, but you have to sign up, right? If you scroll down a little more, it says, I want to apply for benefits, ready to apply. need to upload a document, if you, without, and you want to still upload, you can upload. You want to learn more about benefits, etc. So anyway, lots to explore. Just makes life a lot easier when you can do everything online, right? Thank you, Lonnie. And resources. So remember earlier I had told you that this is the Medi CAL eligibility manual. Fantastic. Now, some of the information may be not up to date. For example, the changes to the immigration, the changes to resources, those are not going to be there because this was published in 2016. We're in 2024. So you need to obviously, read it with that in mind. If you ever have any questions or issues with regard to Medi CAL, you can call us. Health Consumer Alliance is also a great organization for that. Healthcare options. If you are not sure, you're on Medi CAL, but you don't know if you're in fee for service or if you're in a managed care plan or what managed care plan you're on, you can call Healthcare Options. They even can tell you if you have Medicare, what Medicare program you're on. They can talk to you if you want to know if you're in a county where you can choose between a couple of Medi CAL managed care plans. You can talk to them and say, hey, these are my needs between these two managed care plans, which one would cover what I need. It's a great resource for people. And you can open the link to learn more about healthcare options. If you're having trouble with your Medicare managed care plan, there's the Office of the Ombudsman for Managed Care. And you can always look at that link for more information. Okay, so we've come to the end of the presentation and we have time to take questions.